In this tutorial I will not discuss the anatomy of the larynx, only the muscles of the neck. So here is I've drawn the hyoid bone, thyroid cartilage, cricoid cartilage, and the trachea. Now out of all of these, only the hyoid is a bone. The thyroid, cricoid, and the tracheal rings are all cartilage. Cricoid cartilage is the first tracheal ring. And here I have depicted the thyroid gland, and where the two lobes of the thyroid gland meet is called the isthmus of the thyroid. So there's a membrane here connecting the hyoid bone to the thyroid cartilage, and this membrane is called the thyrohyoid membrane. Thyrohyoid. The thyroid cartilage in males is also referred to as the Adam's apple. So this is the portion that sticks out of the neck, and this portion that sticks out is called the laryngeal prominence. Okay, so this is the side view, this is the front view. Next, there's a ligament that connects the cricoid cartilage to the thyroid cartilage, and this is called the cricothyroid ligament. This is a membrane, this is a ligament. In some books they'll also say this is a ligament, so it doesn't matter. This is the thyrohyoid membrane or ligament, this is the cricothyroid ligament, and this is the cricotracheal ligament. So now that we have the basics underlying structure, we can put the muscles on top. So the first muscle here I'll show you is going to be the thyrohyoid muscle, and it is the muscle that is going to connect the thyroid cartilage to the hyoid bone. And it usually, so from the front you can't see very well, but it comes from about the side of the hyoid bone and attaches to the side of the thyroid cartilage in an angle. So on this side and on this side. So here are the two muscles that connect the thyroid cartilage to the hyoid bone and are called the thyrohyoid muscle. Next, there's a muscle that connects the thyroid cartilage to the cricoid cartilage, and that is called the cricothyroid cartilage, and it comes at the same angle here. So this muscle, this is only the front view. From the side it actually goes on the side of the thyroid cartilage. It's not just the front portion, it's the entire side. So below here, also at an angle, is a muscle that will connect the cricoid cartilage to the thyroid cartilage, and it's called the cricothyroid muscle. So here we have cricothyroid muscle and thyrohyoid muscle. Thyrohyoid ligament or membrane, and cricothyroid ligament, cricotracheal ligament. Thyroid gland, isthmus of the thyroid. Next is a muscle that will connect the clavicle and the sternum to the larynx. So here I just have sketched the clavicles and the sternum. So here's the manubrium and the clavicles in rib 1, rib 2, and body of sternum. So there's one muscle. There's actually going to be two muscles coming off the sternum. One of them is going to go from the sternum and attach to the thyroid cartilage, and this is called the sternothyroid muscle, and it comes up from the side here. We're at the junction of these thyrohyoid and cricothyroid muscles, coming from there all the way down to the sternum. So this will connect the sternum to the thyroid cartilage. Okay, so I have only drawn one side because it'll take too long if I do the other side as well. So you can imagine the same sternothyroid muscle on this side. Next is so these are the three muscles associated with the thyroid cartilage: the thyrohyoid, cricothyroid, and sternothyroid muscles. Next, so that's done with those muscles, with the muscle associated with the thyroid cartilage. Next is a muscle two muscles, and I guess I'll show you in this diagram in here. So one is going to be a muscle that connects the hyoid bone to the sternum, so it is called the sternohyoid muscle. This here is the sternothyroid muscle. Then there's a muscle called sternohyoid muscle.